In other news, environmental health workers whose duty it is to conduct the burial of persons who die of coronavirus say it is unfair that they are not entitled to the incentives being given frontline health workers involved in the fight against the COVID-19 pandemic. As members of the Ghana Environmental Health Officers Association, they are also engaged in surveillance, disinfection, as well as isolation of COVID-19 patients. Leaders of the Ashanti region branch say government must immediately rectify what they describe as an anomaly, as their members stand an even greater risk of being infected in their line of duty. Love FM's Erastus Sasaridonko has more.
Meet 45-year-old father of 5, Adongo, an environmental health person. His job entails disinfecting suspected coronavirus-infested environments, preparing and burying of deceased persons who had been infected with COVID-19. Adongo has been actively involved in such activities since the first confirmed case and subsequently death of patients in the Ashanti region. He tells me the risk to his life is high, as he sometimes has to reuse disposable protective equipment or virtually beg for a new one to discharge his duty. Despite his exposure to the disease, he is not counted as a frontline staff and currently doesn't benefit from government's stimulus package.
This year, me free na tade amode mama me dia ma hyew but me wi ma woro ho na ma hye no na dia hye no me kwa yiti me woro dwa state na ma ko woro mo ho na ma gal na me so ku tade na hye this year ma me no me yer no me makora ya mben wife to no ko na so me teme ko fa body bi o baby sa body ni tade me ko fa ri ko cemetery ko sie no sa body ni tade na me sa ri ko fa afoforo Tadia Bacope, Mudufunu. At least that time, me Bacasabi and Boss Bacasabi, I mean to say, Jumandoconi, ye mano, and try yes, me, Manaba Trade. A mamma who never followed the emboss of panel. You see, I was here, and so colonial virus to say, I so chat. Spoke a crabby, I saw Yasane. It is going to do, I could do nest, daughters, yea, and
Let's move. Elvis also supervises burial of confirmed or suspected COVID-19 victims in Kumasi.
I could remember when we went to the Obuasi for the 4th burial. We went there and the PPEs were inadequate because the body was in a cold room. They do not have a mortuary where we have to dress up with all our PPEs coverall to go there and pick the dead body, which is in the body bag, into the casket. And right after that, all PPEs must be discarded. Then when we get to the cemetery, we have to use another PPEs, nose mask, gloves. All these things are utilities that need not be used more often. Immediately go nearer the body, after picking or doing one or two things, you have to change them. And this has been a very big challenge to us. Because
Adongo and Elvis represent many environmental health staff on local government payroll working on COVID-19 teams across the region. They say, unlike their colleague health staff, they have been excluded from government packages despite being exposed to the similar risk. The Ashanti Regional Association of Environmental Health Officers is not happy. Stella Gabriel is the regional president.
Your members of your association feel?
Well, in fact, we feel very disappointed and dejected. We have always been on the field together with other health workers. We are part of the rapid response team, the district management team. We also are in charge of disinfection. That is from the house of the infected person to even the hospital facility. And when the person dies, we take care of the burial. What can be more contagious than these activities that we carry out? Just like any other health worker, we have contact with the patient whilst alive, and when the patient passes away, we are being asked to take care of the dead body. And when it comes to enjoying a motivation or motivational package, they are trying to sideline us, which I think is very disheartening.
Head of Local Government Service, Dr. Nana Ato Arthur, says concerns of the environmental health workers have come to his attention, and he has forwarded same to government for redress.
In the current fight against the COVID-19 pandemic, environmental health officers take a frontline role, rubbing shoulders with their health practitioners on the field. When it comes to prevention, they are in people's homes. They are fumigating areas, disinfecting areas where suspected cases are. They bury the dead from COVID-19, but they are not counted as frontline workers who should benefit from Ghana's stimulus package. They are demanding their fair share of the national cake. Reporting for Joy News, Erastus.